Pectoris. What is angina pectoris? Angina pectoris is disease when we have oxygen deficiency in the heart. We have oxygen deficiency in the heart. It means that we can supply heart by enough oxygen, and heart can't have enough oxygen for the well working. In this regard, we have angina pectoris. This is the pain in the heart. This is most popular disease in the population, especially in the men. This is the men's disease. Yes, this angina pectoris is pain in the heart. We have pain when heart can't receive enough oxygen. We have oxygen deficiency in the heart. So heart can't work good because it has no enough oxygen. Why we need oxygen? Oxygen, this is the main component for the receiving energy. To receive energy, we need oxygen. To receive energy. The energy source in the body is the degradation of sugars and degradation of fats, lipids. So for the degradation of lipids, we need oxygen. Lipids give us more energy. For the degradation of one molecule lipids, we are receiving 160 ATP. ATP is energy. ATP is energy containing molecule. For the receiving energy in the body, we need ATP. And one molecule fat give us 166 ATP. It means that for the producing of energy, we need fats. So the heart also for the producing energy needs fats. But for the receiving energy, for the degradation of fats, we need oxygen. So when we have oxygen deficiency, the heart can't receive enough oxygen. Therefore, we have angina pectoris disease, pain in the heart. The main complication of angina pectoris, we have infarct. You know this disease, infarct, when the heart tissue someplace is died. We have in this case because if the oxygen deficiency continue long time, this muscle will be died because it cannot receive enough oxygen. Therefore, this muscle will be dying finally. So this is infarct, the main reason of the people's death in the world. The first place takes cardiovascular disease in the mortality rate of people. Mortality rate, what means? It's death of people. It's death. Mortality means death.
Ölümcül.
Muscle happens in the muscle wall, yes?
Yes, it happens in the muscle because the oxygen supply is less in this regard. What is the main reason oxygen deficiency? Main reason oxygen deficiency is atherosclerosis. So the heart has their own vascular vessels, okay? This is vascular vessels, blood vessels. It means that for the enough circulation, we should blood vessel. But sometimes in the vessel we have atherosclerosis disease. During the atherosclerosis disease, inside the vessel we have fats, cholesterol inside, fats. And blood vessels inside may contain, in the vessel wall, may contain fat molecules. This is atherosclerosis. In this regard, blood is narrow, blood vessel is narrow, and here is less oxygen inside. Less oxygen inside. So this is the main reason of the angina pectoris, which is induced by the deficiency of oxygen in the heart. So in this regard, we need to avoid this deficiency. How? The first drug is used to treat the angina pectoris is nitrates. Nitrates. Representatives is nitroglycerin. This is the most popular drug in the world. Many people are carry this nitrogen in their bag. They are all times they have all times nitroglycerin. Nitroglycerin is the drug what is the mechanism of this drug? Mechanism of this drug is to decrease oxygen demand. Decrease oxygen demand, and it means the increase oxygen supply. Increase oxygen supply. How? The nitroglycerin, the main mechanism is relaxation of cardiac vessel. Relaxation of cardiac vessel. Cardiac vessel. Relaxation of cardiac vessel. It means that when this vessel is relaxed, it means that more blood may be passed through this vessel. It means that more oxygen may be supplied to the heart, right?
Yes.
This is the main thing to increase oxygen supply. Also, when we decrease the contractibility of the vessel, it means that heart will work less active, because for the heart working, we need less resistance from the vessel. So when the vessel is contracted, it means that heart should contract more active to avoid this resistance. What does it mean? When we have blood vessels, narrow blood vessel, and another example, wide blood vessel. When we have wide blood vessel, it means that the resistance of this vessel is low. When we have narrow blood vessels, which is the resistance is high. To avoid this resistance, heart should work more active to avoid the high resistance, right? Yeah. In this case, heart needs more oxygen, right? To
because
avoid
flow is high in the narrow blood vessels, yes?
Yes, flow is high in the narrow, and blood needs more oxygen to avoid this resistance. But when the resistance is low, when the vessel is wide, heart needs less oxygen. So these nitrites also increase this relaxation of the vessel, it means after the nitrate, the blood vessels are relaxed. It means the resistance of blood vessel is decreased, and the demand of oxygen on the oxygen supply also decreased, right? So next group of the but what is the side effect of nitrates? Side effect of nitrates is it's big headache. It means that, and also the nitrates has a short half-life. It means that after 2 hours there is no nitroglycerin in the body. So you should give to the patient 12 times a day to achieve the result. It means it is not comfortable for treatment. It's just to give as an emergency drug. So
what about trinitrin mask? Trinitrin? Is it the same or different?
Trinitrin is the same. This is the same.
It's the same.
This is same. We have a different solution for the enhancement of half-life. For example, there is some patches. Patches, you know what is patches? It's like a plaster which contains nitroglycerin, and these patches are used on the surface of the skin, and during this treatment, this nitroglycerin is passing through the skin very slowly. It means that we can enhance half-life in the body. Also there is some buccal stretches also inside plastic inside the mouth. So this is also for the enhancement of half-life. So next group is calcium channel blockers. Calcium channel blockers. We have representative verapamil and nifedipine. Nifedipine. Verapamil and nifedipine. So, in this regard, what is the calcium function in the body? Do you remember that we have 2 fibers in the body which are responsible for the muscle contraction. Actin and myosin. This is actin. The first one is actin. Myosin. So, actin and myosin are connected to each other by the myosin heads. Myosin heads.
Yes.
So, when they are connected to each other, we have relaxation. Yes, but when the calcium goes here and connected with this head, these heads are disconnected with the actin, and actin and myosin are moving on each other, and we have contraction. So we need calcium for contraction. When we have high level of the calcium, we have contraction. If they block calcium channels, we have no calcium inside, so it means that we can't disconnect of this head, and we can't achieve relaxation. We can't achieve contraction. So we have relaxation. Calcium channel blockers induces relaxation of the vessel. If we relax this vessel, it means that we decrease peripheral resistance. Peripheral resistance. will be decreased. When we decrease peripheral resistance, it means that we decrease demand on the oxygen. We need less oxygen for the heart working. This is the mechanism of calcium blockers. And the third one is beta-1 blockers. Beta-1 blockers, for example, propranolol or carvedilol. This is the drug. What is the beta-1? What is the main function of beta-1? When beta-1, when we activate beta-1, it means that we increase contractibility. Right? We will also contract. When we block beta-1, it means they block contractibility. When the heart receives beta-1 antagonist, it means the heart works slowly. We need slow heart working because we have no enough oxygen for the working. When we decrease heart working, it means decrease demand on the oxygen. We don't need so much oxygen in this regard. So the beta blockers also are used for the treatment of angina pectoris. And finally, there is some special drugs. It's very new drugs. It means that if you remember, I explained you how the body is receiving energy. So we are receiving energy from the sugar, glucose, and from the fats also. Fats, for the degradation of fats, we need oxygen. But for the degradation of sugar, of the glucose, we don't need oxygen. So there is some drug which blocks the fat degradation process in the heart and increase glucose oxidation or glucose degradation. Glucose degradation, it means heart does not need any oxygen, but heart are receiving energy for the working. So this is new drugs. Is it clear the mechanism of action of new drugs? New drugs are blocks the energy receiving process which needs oxygen and are activates the process which does not need any oxygen for receiving.
What's the name of this drug was?
This is new drug. This is nifedipines, but you know it's just under the monitoring. It is not used so widely. So this is new drugs. So, but now the main popular treatment is surgery. Surgery. In this regard, there are the method when they are put some balloon inside the vessel and they try to increase vessel's volume. They are increasing balloon's volume and therefore here they place balloon here, some balloon, and increase the volume inside by increasing the vessel's lumen diameter. Tentation, if you hear this is very most, it's like you place some catheter inside the vessel, catheter with balloon inside. And in this case, they are, it's not whole surgery. They are just putting in the artery this balloon from, they are using legs, and they are reach to the heart vessels, and they try to increase the volume of the vessel inside, the the diameter of the vessel of the cardiac vascular. Okay, this is the angina pectoris.
Teacher, I
Yes.
have a question. Why only men diseases angina pectoris?
Not only, but mostly.
Only men diseases, yes?
Hayır abi.
No, mostly men.
Genellikle.
Mostly main disease because.
Why? We are
What is the
small.
reason?
Huh?
Because men like to drink wine.
Ah.
With wine they are eating very fatty.
Cigarettes also.
And also they are drinking a lot of wine damage liver. Liver functions deficiency give us atherosclerosis. When the liver does not work so well, we have high level of cholesterol in the blood. High level of cholesterol give us atherosclerosis. This is cholesterol high liver. It's because of damage of the liver. Liver damage is main final result of a lot of wine during this.
How the wine is affecting our heart in good way? How it's happening? Doctor said
In good way. Heart. If the wine is in a small amount, this wine increase the diameter of the vessel. It's like a vessel relaxant, vessel dilatator. Even during the war, when the soldiers are dying, somebody gives him wine to. Yes, please wait 2 minutes. To enhance oxygen circulation by relaxation of the vessels. This is a good result. But when the people are taking a lot of 2-3 liters
so it is good to drink a small amount of wine every day, yeah? It is good for body.
for body also and for the heart because it relax heart vascular and increase oxygen circulation because it has a vascular relaxation effect.
Why do you so?
It contains tannins, and tannins act to the contraction and relaxation of the muscles. Smooth muscles.
Gidiyoruz. Yeter.
Let's drink wine.
Ama